All right. Good evening, everyone. My name is Dr. J.S. Rad, and thank you for joining us this evening. We are going to be talking about a very common subject here of erectile dysfunction tonight, and let's get started. So this, by the end of this presentation, I hope you'll have a better sense of what erectile dysfunction is, what it's caused by, and as well as learn about some of the treatment options available. We'll have a Q&A session at the end to answer your questions, and feel free to send in questions by using any of the options listed here. Just a brief introduction. I completed my undergraduate studies in the Honors College at West Virginia University in Morgantown, West Virginia. I did my medical school in Lewisburg, West Virginia, and my urological surgical training in Michigan. There I was able to get trained in some advanced treatments, including treatments for erectile dysfunction, and we'll talk about some of those here tonight. The agenda here demonstrates a few of the topics we'll hit on, and again, don't be shy about asking questions at the end. We'll definitely go through any of the concerns or questions you may have. Before we dive into it, let's take a few moments to discuss the term erectile dysfunction. I always talk about the negative connotation that's associated with this term, and many men don't really seek care for this condition because of that negative connotation. So it's important to recognize that ED is part of the natural aging process, part of life, and it is tied to a man's overall health and well-being. And so it's important for us to discuss it and make sure that you remain healthy in all aspects, including erectile health. I often refer to this topic as erectile health or sexual health. I think it's important to change the way we look at this condition in order to be able to help more people overcome it. Our goal today is to talk about how you can maintain your sexual health by appropriately diagnosing and treating the problem at hand. So let's look at the formal definition here again on this slide. ED is defined as the total inability to achieve an erection or an inconsistent ability to achieve an erection rigid enough for penetration. There may also be a tendency to sustain only brief erections. So any of these can fall in the definition of erectile dysfunction. Here are some facts about ED. There are about 30 million men who suffer from this condition, or in simple terms, 1 in 4 men experience ED in some form during their lifetime here in the US. This is a gross underestimation, I think, as most men never seek help to be identified and be accounted for. Most of these men are able to have orgasm and father children, but due to inability to have or maintain erections, they have difficulty with these things. And, most patients that see me in the clinic, they do so not because they want to have kids in hand, but because they're missing that intimacy part in their relationship and don't want to give that up, whether that happened because of some medical condition they encountered or because of aging or some other factor. They want to have that back in their relationships. So what are some causes of ED? Most causes are related to other medical problems, such as an injury. It could be a brain injury, a disease such as diabetes or hypertension, or often both, an operation perhaps for prostate cancer, or perhaps even radiation therapy, or other substances or medications. So there are a variety of things that can affect it. As I mentioned before, ED can be a marker for cardiovascular disease, as the penis is a vascular structure, and vascular disease can affect any organ in our bodies, including the erectile tissues. The arteries in the penis are about 1 millimeter in diameter, whereas the arteries in your heart are upwards of 4 millimeters in size. So you're likely to experience ED before full manifestation of heart disease. And if you're a young guy and you come to my office and you are discussing ED, I may be looking at cardiovascular disease first. I may do a cardiac workup or refer you to a cardiologist. So those are some important relationships that we have to keep in mind. These are the risk factors for ED, and we will review each one of these in the upcoming slides. I touched on aging a little bit, and that is a natural part of the aging process, but you don't have to necessarily accept it and give it up, give this part of your life up. Most frequent PCP office visits are for hypertension, diabetes, cholesterol problems, which are all causes of ED, as I mentioned before. And so when we do an evaluation for the first time, we look at that and make sure that if there is an area where we can optimize you so you can have natural erections again, we do so. Diabetes and hypertension are especially common conditions in the US. It is important to optimize the treatments for these problems to help maintain your sexual health. So if you're diabetic, being on a good diet, being on appropriate medications, or if you have high blood pressure, being on the appropriate medications are important. Sometimes the medications you're taking for these conditions can actually cause ED. So again, it may be important for us to recognize that and switch you around in terms of your medical therapy. It's also very important to address these issues so that the treatments for ED have a better chance of working for you. So here you can see on this slide the increased risk of ED with each of the conditions I just mentioned. Now, prostate disease we didn't touch on much, but prostate cancer and BPH are perhaps the two most common diseases that urologists such as myself treat. Let's focus on that a little bit more here on this slide. So prostate cancer is the second most common cancer in men. About 1 in 9 men will be diagnosed with prostate cancer during their lifetime. And it's estimated that there will be about 250,000 new prostate cancer cases in 2021. When I gave a similar presentation last year in 2020, the estimate was about 200,000. So that has increased by about 50,000. And there are going to be, unfortunately, about 34,000 deaths from prostate cancer. It is therefore extremely important for all men ages 50 and above to see a urologist and get tested. If you have a family history of prostate cancer, you should get tested at an earlier age. Now, unfortunately, some of the treatments for prostate cancer can potentially cause damage to the nerves and blood vessels of the erectile tissues and cause erectile dysfunction. It doesn't matter if you get radiation therapy or have your prostate removed. The risks are essentially the same when we look at long-term data. Now, I think that in 2021, we all know that smoking is related to just about every disease out there. Some medications that you may be taking can also adversely affect your sexual health, as I mentioned before. So it is important to discuss these medications with your physician. One thing that sometimes patients forget to mention to us or bring up is herbal medications. So sometimes you may be taking stuff over the counter and you may not think of those things as medications. Make sure you mention all those things because even herbal supplements can sometimes affect certain aspects of your health, including erectile health. Now, let's briefly talk about the anatomy and the process by which an erection happens. That's important. There are essentially 3 cylinders in the penis. 2 of them are responsible for erections, and 1 houses the urethra, the tube that men urinate through. The 2 that are responsible for erections, they fill with blood once sexual stimulation occurs and create the rigidity that allows for penetration. If there's a problem along any part of this complex path, then ED can develop. So this slide essentially just reiterates that process that I just mentioned. So now we're getting to the meat of the presentation, and that is treatment options. I always tell my patients that there are generally 5 treatment options available for guys with ED, once all the causative factors that we discussed earlier have been addressed. First line, we have medications such as Viagra, big blue pill. We all know about that. We've seen the advertisements, which is probably the most famous one worldwide. I often tell patients that medications can be both diagnostic and therapeutic. If I give you a medicine for ED and you have satisfactory erections without side effects and are happy with it, then we leave it at that, and that's therapeutic. If you're unable to have erections despite medication, then your disease is most likely more advanced, and we should talk about more advanced treatments. And that's the diagnostic portion where if you're unable to get erections with medicines, I'm diagnosing you with more advanced disease. Some men have to stop medical therapy due to side effects, and some of these are listed at the bottom of the slide. Headaches and facial flushing are perhaps the most common ones, followed by muscle aches. The next option is injection therapy, and usually the second I say injection to a patient, they grimace, and rightly so, although this is often a pretty successful form of treatment in terms of achieving and maintaining erections. It's, in my opinion, a little unnerving. If I tell a guy they have to stick themselves in their privates with a needle, they get a little bit nervous. Aside from that fact that you have to be comfortable sticking yourself with a needle in a very sensitive area, there are also some well-documented side effects, such as erections that last too long and end up getting you to the emergency room. And so when you hear about that 4 hours of an erection go to the ER, it often happens with injections. Medications do not cause that as commonly. There can be bleeding, there can be bruising, and pain at the injection site. Sometimes scar tissue can develop with a repetitive use, and that leads to a curvature in the penis known as Peyronie's disease. And again, all of this leads to poor compliance on the patient's side. Another option is vacuum erection devices, or VEDs. These are simple pumps that come in manual or battery-operated forms, which pool blood into the chambers of the penis, and by placing a ring at the base, you can maintain the erections. This is less invasive, fairly safe initially, drug-free, and cost-effective. But there is a learning curve associated with the use, and the erections don't feel as natural and often are cold to touch. And so a lot of patients say that it doesn't feel natural. The main problem with this method, though, is the fact that it takes the spontaneity out of intimacy. You have to go excuse yourself, go mess around with the pump until you have an erection, and sometimes the ring you put on to maintain the erection can get stuck, and you end up in the emergency room to get the ring taken off. And so as a resident, I used to get called to the ER all the time to get these rings off. And it can be quite uncomfortable for the patient. The next option listed here, and I'm going to mention this very briefly, is suppositories. Suppositories are available with an applicator that allows you to insert them into the urethra. These pellets dissolve and create an erection by local effect of the medicine. But this works only half the time. It's painful, can cause urethral bleeding and scarring, and most patients stop using it after the first time. So in my practice, I don't even prescribe this anymore. And most urologists, especially those that are trained in prosthetic health or prosthetic surgery or men's health, they don't even recommend this anymore. Now, the fifth option here is the penile prosthesis. Most men have not heard of penile prosthesis before, and that's because most men who have them don't talk about it. A lot of patients in our community have them, and I know because I put them in. Because of that, I'll focus on this treatment a little bit more because it's foreign to most patients. Now, you may find it odd that someone would put a prosthesis in their penis. I would compare it to a hip prosthesis. When your hip goes bad, you get a prosthesis so you can regain quality of life and mobility. When your erections go bad, you can get a prosthesis so you can regain quality of life and get your sexual function back. It's all about how you look at it and really that quality of life that we all look for. There are two types of prosthesis. One is a malleable prosthesis that you can see here on this slide. And the other one is an inflatable prosthesis, which I'll talk about on the next slide. The malleable prosthesis is essentially a bendable tube that we insert into the erectile bodies, and it keeps the penis at a certain length at all times. You can then fold the penis up or down and keep it in a position suitable for intercourse. It is fully concealed in the body and very easy to use, especially if you have limited dexterity. So patients who have arthritis or weakness in their hands and can't otherwise use a three-piece penile prosthesis, they favor this device. The downside is, of course, that it stays firm regardless of whether or not you're having intercourse. We sometimes may place one of these in men who are overweight, can't lose weight, and therefore their phallus is buried deep in the pelvis. These men may not be able to pull the penis out far enough to urinate. And by putting one of these in, they're able to use the bathroom properly again. So in this case, it is used for a different reason than ED. But most often we implant this for patients with erectile dysfunction. This is the inflatable penile prosthesis I mentioned, and it's called the Titan. I think it's a great name for a penile prosthesis. It is completely concealed, has a natural look and feel when not in use, acts and feels more like a natural erection, and although it can't increase the length, which is a question we get quite often, it often expands girth of the penis depending on the size that we're able to put in. It consists of 3 parts. There's a reservoir that contains the fluid, the cylinders that are implanted in the penis, and a pump that is placed in the scrotum. Now we're going to review an animation that kind of demonstrates how this works. So looking at this, you can see the 2 erectile bodies, and the reservoir is deep in the pelvis. You shouldn't be able to feel that. The cylinders are in the penis and those chambers I mentioned, and there's the pump. Now, by squeezing on the pump, fluid is transferred from the reservoir into the cylinders, and that gives you the erection. And depending on your natural penile length, you may have to squeeze the bulb several times to get the erection and enough fluid in it. Once you're finished with intercourse, you push on a pump, and by gentle squeezing of the penile shaft, the fluid goes back into the reservoir and it goes back down. Now, this is very simple to operate as long as you have some good dexterity. And that's why I mentioned that people with arthritis or conditions that will not allow their hands to function properly to squeeze the pump, in those patients, we may elect for malleable prosthesis. Now, just like the other options, there are risks associated with an implant as well. There's an initial risk of infection, which is typically reported as about 1% or less, depending on who puts it in and their experience. It is important to note that not all urologists do this procedure, and it's important to find one that's capable and has a good track record. I always tell my patients that once you get this, you can't go back to the other options, and it's meant to be permanent. So if you have a prosthesis put in, you can't take it out and go back to injections or some other modality. And typically, when you get to the point where you need a prosthesis, you have already tried some of the other options and they have not been adequate enough. There's a risk of erosion and migration depending on use and underlying medical conditions such as diabetes and soft tissue disorders. Some patients have reported chronic pain, although that is rare, and device malfunction, as this is a mechanical device, but again, this is rare. Finally, this is a surgical option, so there are always risks of surgery like infection, bleeding, damage to surrounding structures, and anesthetic risks. Again, this is a fairly minimally invasive procedure, and therefore these risks are minimized in experienced hands. Now, on this slide, a common question is about insurance coverage. I consider myself illiterate when it comes to cost and insurance issues. I'm hospital employed and fortunate enough not to have to deal with these things, and I can focus on doing the thing that is in my patient's best interest. Having said that, insurance can be a problem, and so patients always ask about it. As you can see, most insurance plans, including Medicare, provide coverage for this procedure, and my office gets pre-authorization from insurances before I take a patient back to the operating room, so there are no unexpected bills later on. Mon Health Medical Center, where I work, also offers large discounts to patients who pay out of pocket if this is a concern of yours. Coloplast also has resources for patients to help with coverage, and again, these are listed here. Here are some additional resources you can access online. Again, if you decide to come to our office, I'll provide you with all the resources you need. And Mon Health Medical Center is a very well-known and respected hospital with a community focus. So we all treat you like family here. And so we guide you through the different steps and make sure that you receive the best care possible. Now, we're going to actually go to this slide. This is a brief video of a patient and their partner who went through this journey to drive the point home, and I will take some questions afterwards.
Hi, my name is Stan Rydelic, and I'm 61 years old, and I live in South Carolina.
I'm Teresa Rydelic. I'm 60 years old, and I met this gentleman when I was 15 years old, and we've been together ever since.
I've been married to my wife, Teresa, we've been debating this, 39 years. 39 years. 39 years.
October.
39 years of bliss. About three and a half years ago, I ended up getting ill. I thought I had the flu. It turned out that I had complete liver failure, and so unfortunately, or fortunately, I had to have a liver transplant. As part of the procedure to nourish my liver, I found out what they did is they rerouted some of my blood flow, and so I ended up with a condition called arterial insufficiency, which basically means that the lower part of my body had insufficient blood flow. After I had my liver transplant and I was feeling well again, and then I found out that things were not happening romantically. It was kind of a surprise. So what I did was I asked my general practitioner, and so he immediately says, well, you know what? All you need is some Viagra. So what he did was he gave me a prescription for Viagra. I went home. I remember that evening, I was thinking, oh, how wonderful, Viagra. Of course, it's going to be a great evening. So what I did is I put some music on, poured some wine for my wife, lit some candles, and guess what? Nothing happened. So I went back, and and every time we're going in, it's just like it's 2 weeks or so between appointments, and it's still like nothing's happening, and you start to really get very discouraged. So the doctor gave me a choice. He says we could use vacuum erection devices, he says, or we can also use an injection. So I said, let's try the vacuum thing first. That was horrifying. Well, first of all, in my opinion, it was horrifying. It didn't really work. So that was like a one-time shot. And then we tried it was Trimix that I tried. And so I thought that was going to be great. Went home, and again, since there was a tiny bit of success, I thought this was going to be a great evening. So you try to get all romantic, and then you say, oh, excuse me, honey, I have to go into the bathroom and inject my penis with Trimix. I did everything that I could, and quite honestly, I had never even heard of a penile implant. And so this doctor I went to, he was a young gun, kind of like, cutting edge, and he says, well, I think the only thing that we could do, he says, to really guarantee that you can get an erection is a penile implant. So Teresa was a part of the process. She came to the doctor's office with me, and what we did is we had the discussion about it, penile implant, and she said, look, if it means that much to you, she goes, I want you back how you were. I want you happy. A couple things came up. The first one that I worried about was the procedure, a painful procedure. And quite honestly, I was told, and after experiencing it, it's an outpatient procedure. It takes less than an hour, in many cases a half an hour or less. Another thing that concerned me also, and this one's going to sound really, really very strange, but I really worried that I would have the desire to have sex.
Well, it's kind of ironic because that's exactly how I felt. I felt like, well, he's going to get this implant. We hadn't had sex in so long. Maybe that chapter's over. And I think that a lot of women worry that they're not going to be ready for this new adventure like they were. And it actually has been a renewal of our relationship in one area. And so I'm glad. I'm just glad he it's freeing. It's taken on where we can be spontaneous, just so different than years before.
There was a romance.
Yeah.
There was a spark that was put back that we didn't know went out. The thing that's really, I think, been wonderful with an implant, with the implant, which I honestly, I don't consider I have an implant anymore. It's just, it's a part of me.
Right.
There's no, well, first of all, from the standpoint, if you look at me, if you saw me in the shower or whatever, you cannot tell that I've had an implant at all. And then also from the other standpoint is you have complete spontaneity. There is never anything where you have to say, okay, you know what, I'm going to take a pill and wait a half an hour for it to happen. If you're in the mood, you're in the mood.
Right.
And you know, I mean, it turns back the clock. I mean, I honestly feel like we're in our 20s or 30s.
Since the implant, there's a confidence there that is actually very sexy. And that confidence is something that I think the implant did for us. And I don't worry that it was me, you know, that maybe I wasn't something that he was needing. No, we're perfect for one another, and now we have back our love life. If I could give some advice to someone dealing with this, a couple dealing with this, I would say talk to one another, be honest and open and loving, because the answer may be no. The answer may be, no, I don't want to do this, and it may be, I've been thinking about this. So I think communication is the key.
If I could give a piece of advice to anyone suffering from erectile dysfunction, it is the fact that you have one life and you have the choice to choose how you live your life and at what level of quality you live your life. So if you're suffering with something like erectile dysfunction, that's fine, you can live with it, but you don't have to. It's something that is so easily fixed, and you could have the quality back in your life that makes you a whole person again.
All right, so I think this obviously is a very powerful video, and this is not anything atypical. We hear that in our offices all the time. A lot of men, like I said, just don't know about these options. Penile prosthesis surgery has been around for over 50 years now, and so it's nothing new. This is not something that was just developed over the past couple of years. And the partner and patient satisfaction rates are higher than anything else we have available, including medications. The partner and patient satisfaction rates, as a matter of fact, in every study have been above 95%. And that speaks for that spontaneity that patients can have back. And also as a man, it's nice to have that ability to have and maintain erections at any point, any time that you want. And even if you're finished and the man orgasms, you can still continue and satisfy your partner. So I think that aspect of it is very powerful. I always joke with my patients that essentially the penile prosthesis makes you a little bit of a superhero, something you wish you had been in high school. And so I definitely think it's something worthwhile to consider if other options fail or there's a real problem with side effects. It's important to note that penile prosthesis procedure, as I mentioned previously, is a urological subspecialty, and not all urologists perform this procedure. For instance, I have two partners in my practice that are urologists but don't perform this procedure. So make sure you always research your physician and ask for someone who is experienced and trusted and has a good track record for excellent outcomes. Going to solveednow.com, you may be able to do a physician search and find some of the physicians in your area that may be able to help you. But again, our good outcomes, surgical outcomes, are always dependent on the surgeon and the team that surgeon has at their respective practice. And at Mon Health Medical Center, we have one of the best teams available to our patients, and we definitely have a good track record in our community. I'll also include our contact information in case you have some additional questions, you want to talk to us. And in the post-COVID era, one of the nice things is even if you live out of state, out of town, patients have contacted us and have actually done their first visitation through telehealth, which makes it convenient. If you're in Massachusetts and you find a physician in West Virginia and you want to talk to us and find out a little bit more about your specific condition and discuss it, you don't have to travel all the way over and don't have to spend all the money in travel. You can simply call us, make an appointment for telemedicine, and we get on a video chat, discuss your symptoms, review your chart. If there is any imaging, we can review on the computer and give you an assessment right away. If you go to monhealth.com/urology, you can, and I typed it in the chat box, you can always make an appointment and you can indicate if you want it to be a telehealth. If you go to my personal website, radroboticsurgery.com, you can actually learn a lot more about the different conditions or any urological conditions. And also you can ask me questions on that website directly. Our phone number for Mon Health Urology, I'll type in here as well in case you rather speak to a person instead of going online. And you can give us a call. You can request which physician you wish to speak to, and that's also very helpful. And we usually get back to you very quickly. So here's the phone number for that. Again, we can answer questions either through our websites or one of our other locations or venues. So at this